Hello, dear colleagues. I am Dr. Ferhad Mohammed Rashid. I am a general surgeon fellowship of the Kurdistan Association of Medical Specialty. As a part of the integrated system, today I will talk about the anatomy lab and as especially a special tool for the studying and demonstrating and teaching the anatomy session, practical, theoretical one, which is called Sectra table. The Sectra table, by definition, is the interactive learning and teaching device or tool for uses for the real anatomy and clinical cases, both to provide critical thinking in the clinical training. The main idea is for the clinical training. It consists of two programs. One of them is virtual anatomy. You can see the virtual anatomy in 3D, three dimension. You can rotate, you can up down, you can cut, you can highlight all the parts of the human being. And also you can see the many theoretical lectures about the different parts of the body. The second program is the education portal system, which is the online one. It connects the university with the university, university with the teacher with the student, student with the student, teachers with the teachers. You can enter to the device from anywhere, from any device. You, for example, by your laptop, by tab, you at home or at work, you can prepare the lectures, then you can demonstrate on the table. And also you can use other university cases or pictures or CT scans. You can get benefit from their cases and demonstrate their cases for your student. And also we have a library or reference cases for different cases. You can just put the name of the case. You can see in many universities they have this case and use it to demonstration for the demonstration of your medical student. And in this table you can use it for the undergraduate during the college and also for the postgraduate. In the undergraduate you can use for the teaching of the anatomy, histology, embryology, radiology, surgical, general surgery, orthopedic trauma cases, and even veterinary medicine. For the postgraduate, for the surgical planning, how you do surgery. Before surgery, you will do your planning by demonstrating on the CT scan or MRI for the postgraduate student, and also for the demonstrating the radiological demonstration of the postgraduate student. I would like to share one of my students, his feedback and his opinion about this device and system in a new system in the anatomy lab.
Thank you, dear Doctor. Hello, everyone. I am Saeed Nawaf, third-year medical student at University of Zagh. We started to use this device for the last 2 years. It is a new technology. It is applicable and can get access easily in any time, any device, and anywhere. We are get knowledge easily from this device.
Also, we have, as a part of the anatomy lab, we have a small lab consists of some modules of different parts of the human body for demonstrating separately, organ by organ and tissue by tissue, the many parts of the body, especially for the student when they can touch and they can separate small parts of the organ, and all of them are highlighted by their names. And we have also a piece of paper demonstrating the name and the function of the different parts or different organs of the body. We have another center. It's called Simulation Center for demonstrating the clinical science and the procedures for the teaching purpose for the medical student. For example, we have one of the simulation is for the gynecology and obstetric. We have a demi, and you can see the pregnancy. You can see for example, the procedure of the normal labor or delivery of the baby, and you can see the vital signs of the dummy as a real patient. Instead to the real patient in the hospital, you can use this one for the medical and teaching purpose for the medical student. For example, examining the pulse rate, the heart sound, the lung sound, and the sound of the baby inside the abdomen in pregnant women, and also for the demonstrating the step-by-step the normal delivery of the baby for the pregnant women. Another simulation dummy is used for the surgical and medical purpose of teaching medical student. For example, examining the patient, for example, examination of the leg, of the abdomen, of the chest, head, examination of the pulse rate, the heart sound, the lung sounds. It is computerized with the computer, and you can change the sound. For example, the heart sound, you can change to the pathological one. You can set it as a normal heart sound, and also the same for the other system, for example the chest, for example the abdomen, anywhere. And also you can see some you can demonstrate some procedure for the medical student, like in this model you can demonstrate the how to put the endotracheal tube for the life-saving. It's a life-saving procedure in many situations, which is very critical, and you can instead to demonstrate on the real patient in the critical situation for the medical student, you can use this model for the demonstration, how to handle, how to put the tube, how to save life of the patient on the model. Then you can train the medical student for the in real life, in real patients.